Mulvehill, clinical sexologist and orgasmologist, and I'm here with you today for the Orgasm Hour live Q&A on how to orgasm with a partner, what the research actually says. So we are going to go through 6 different research studies today and kind of go through what actually works, like what helps women orgasm when they're with a partner. And next week will be part 2 to help the partners who are with women who may struggle with orgasm. So first, I want to say that the research shows that orgasm difficulty during partnered sex is the most common type of orgasm difficulty for women. And that is not new. The Height Report in 1976, Cher Height wrote a book called The Height Report that was highly controversial when she reported more than 3,000 women. She did a survey of more than 3,000 women, and she found and reported that women said, hey, listen, we can orgasm during masturbation. Our problem is during partnered sex. And we do know the research shows that heterosexual relationships, the orgasm rate for women is considerably lower than women who are in same sex relationships. So, the orgasm gap, which you may have heard about, the orgasm gap, it refers to the gap between the number of times a woman orgasms during partnered sex and the number of times her partner orgasms during partnered sex. And that orgasm gap is greater in heterosexual relationships than it is in same sex relationships. So, thank you for joining me today. And let's take a look at our first study. We are going to look at a study. I'm going to share my screen with you and the entire screen. I'm very excited about today's work, actually, because it's knowing that it is the number one challenge for women in terms of orgasm with a partner. So let's get into what actually works. So this study is a study by Debbie Herbenick, and we've seen her. Welcome. I want to say welcome for all of you who are joining me today and anyone who logs in. This particular study by Debbie Herbenick, we've seen her research in other podcasts for those of you who have watched other podcasts of mine. This is a study in 2018, and it's titled Women's Experiences with Genital Touching, Sexual Pleasure, and Orgasm. Results from a U.S. probability sample of women ages 18 to 94. And this study it's from the Journal of Sex and Marital Therapy, as I mentioned, published in 2018. So there's something really interesting in this study. Let's first we're going to look at the 5 W's of partnered orgasm. The who, what, when, where, and why. That's what this study is going to answer. The who, what, when, where, and why. So let's first take a look at her abstract in what did she actually study. Okay, let me make this a little bigger for you so you can see it. This study's purpose was to assess in a U.S. probability sample of women experiences related to orgasm, sexual pleasure, and genital touching. In June 2015, 1,055 women ages 18 to 94 from a nationally representative sample completed a confidential internet-based survey. While 18.4% of women reported that intercourse alone was sufficient for orgasm, 36.6% reported clitoral stimulation was necessary for orgasm during intercourse, and an additional 36% indicated that while clitoral stimulation was not needed, their orgasms felt better if their clitoris was stimulated during intercourse. Women reported diverse preferences for genital touch, location, pressure, shape, and pattern. So let's take a look at, I want to take a look at a table in here of how the women actually responded to many of the questions. So we're going to go scroll a little bit further down here. And this table here that's highlighted. So Table 6, it says respondents' preferences for different patterns of stimulation during partner genital touch. And here, the largest group, actually the majority of women, was 81.7% said touching your genitals in a repeated rhythmic motion is actually what works to help access orgasm during partner genital touch. So whether she touches her own genitals or her partner touches her genitals in a rhythmic repeated pattern. And then it says here a motion that circles around your clitoris. 78.1% liked that style of pattern. It's called a pattern of touch. So, the reason we're sharing these is so that you can explore different types of patterns of touch and learn what works for you. So, switching between a few different motions, for example, switching from circles to an up and down motion, 76% of women liked that. Often, the same way of touching that's most pleasurable might be too intense if it's done constantly. So, we often hear that on Reddit, right? On the Reddit thread, many women talk about how they get so much intensity that they have to stop. So, that's learning orgasm regulation, like knowing sensation regulation, meaning that your brain and your body can be tuned, kind of like when you tune an instrument, right? If you tune an instrument, you know how to play the tune. It sounds better, it feels better. And it's the same with orgasm. So if you're going too fast and your brain says you need to slow down, then you slow down. Because if we go too fast and then your brain says, puts on the absolute alarm bells, I'm talking mainly during masturbation here, then you have to then it's like, okay, I had to stop. It was too much. So masturbation is like the training ground for your partnered sex. And we're going to see that really as a theme as we go through these research studies. Okay, so we'll go through a few more of the patterns of touches of the respondents' preferences for different patterns of stimulation during partnered genital touch. Making the pleasure last longer by touching slower or less frequently than what would bring you quickly to orgasm. So, this brings me to a comment that was made that I have shared here before about the woman saying that the man put the lube on and started jackhammering away, right? So, what we just heard is that actually going slower is actually going to build the arousal more. And again, we're talking about partnered sex. So that means that, for gentlemen or for the partners, we don't just put lube on and start jackhammering away, right? Because that's what women are talking about on the Reddit thread. Like, oh my God, he put the lube on and started jackhammering away. Um, Women can say, listen, I'm not ready yet. Don't you have to train. Oftentimes we have to teach our partner, maybe train is not the right word, but teach our partner what we like and use our voice. I call that our voice orgasm to speak up for our bodies. So teasing by approaching sensitive areas, but then passing by them, a lot, 71. These are all majority of women liked these types of patterns of touch, moving wetness from the vaginal opening to other areas, consistency, a motion that repeats in the exact same way. 66% of women like that you can continue. Because if you start changing the pattern, it also changes the thinking. Like, right? So the consistency you can move into more of a flow state when there's a level of consistency. Stimulating your clitoris indirectly by moving the surrounding skin rather than directly touching the clitoris itself. Similarly, 66.5%. Constantly changing either speed, pressure, direction, or motion to keep the stimulation surprising. Now, interestingly, we just heard about consistency, and now we're hearing about changing it, right? With a lot of women liking that as well. So, this is where you have to find your own pattern of touch. Do you like the constant changing? I mean, on the vibrator, for example, I have a vibrator with, I don't know, 10 different like pulsing and consistency and all these different patterns of frequency. Finding you might one of some of you might like all of them. I mean, obviously they have different patterns of frequency because women like different patterns of frequency. Some of you might just like certain patterns of frequency, which is my situation. I don't like all the patterns of frequency, just like we don't like all positions or all the types of touch. So we have to learn what we like and how to communicate what we like. And I think that's probably the most important message I can get to you today or share with you today is to learn what you like and communicate what you like to your partner and to use your voice orgasm so that you can have a clitoral one, right? If we can use our voice orgasm, it's like, oh yeah, Suzanne said, use your voice orgasm so that you can have access to your clitoral orgasm. Here we see another one, delay orgasm to achieve more pleasure or a stronger orgasm. That is also liked by a majority of women, touching everywhere on your genitals other than the vagina or clitoris to build anticipation. Also liked having multiple orgasms without taking a break to rest in between them. Just under 47%, actually 47.2%, nearly half of the women liked that, having multiple orgasms, just one after another, bringing extra emphasis onto one part of emotion. For example, more pressure every time you touch the left side. So, and this is again, you can ask for what you like during sex, right? Okay, so let's talk about these 5 W's. I'm going to close this for a moment here, stop sharing this screen, and I want to talk with you about the 5 W's. So, what are the 5 W's of partnered orgasm? Who? So, number 1, and these answers come through this research that I just shared with you. Number 1, who? Choose a partner you feel safe with and connected to. Number 1, choose a partner you feel safe with. This does not have to mean that it's someone that you are in a 10-year relationship with. It can be someone that you know and that you feel safe with. Now, it's more than likely not going to be someone that you just meet on Tinder. And I had a woman who had shared that one time that she was practicing having partnered sex, using cannabis, and she realized that it wasn't good for her. She wasn't feeling safe getting high with someone that she barely knew. So I happen to agree with that. So the key would be to have safe sex means not just using a condom, but safe sex also means feeling safe inside your body. So that's the who. Who? Choose a partner you feel safe with and communicate what you like. Who? And 58%. So in the study we just looked at, 58.6% of the partners knew what they liked, that the women had communicated. The majority of women in the study we just looked at communicated what they liked to their partner. That is so important. It is critical. If you're wanting to experience orgasm, you'll need to communicate what you like and not expect your partner to know what you like and not fake orgasm. Because if you fake orgasm, you're sending a message that, oh, that worked, and they're going to do it again. And if it's faked orgasm, clearly it didn't. You're not sending the right message. So I highly encourage you to use your voice, communicate what you like, and choose a safe partner. The what? Build arousal. Knowing what touch, pressure, rhythm, and stimulation works for you. So these are the 5 W's of partnered orgasm. Who, what, when, where, and why. 77.2% spend time building arousal. So of this last study, 77% of the partners of the partnered sex experience was building arousal. Very important. That's not about putting lube on and jackhammering away, right? So building arousal, very important. Third, when. Give yourself unrushed time. This is critical. Give yourself unrushed time, because what happens is so often we're in partnered sex. I mean, I myself used to have this myself, and I would think, "Oh, am I taking too long? Oh, I have these feelings. Am I going to even orgasm this time?" Um, I can almost guarantee you, if that thinking starts and continues, chances are you're not going to orgasm. So, learning how to stay out of that thinking mode and learning, orgasmic learning means learning new patterns and new ways to speak, to communicate what you desire, to know what you desire, to have patience with yourself. And and next week we'll talk about the partner's role in having patience with their partner as well. That there's no rushed orgasm, there's no did you orgasm yet? So that's for next week on the partners. So, and then the next who, choose a partner you feel safe with and communicate what you like. What? Build arousal. When? Give yourself unrushed time. Take the clock off of orgasm. 43.9% of the women did not feel rushed. Now, how did they not feel rushed? Because they trained themselves not to feel rushed. They were able to fully be present with the experience. And it's trainable. Orgasmic learning, it is trainable. That's why I'm doing this, because as one who suffered for more than 30 years with orgasm difficulty, alone and with partnered sex, and then I learned how to orgasm with medical cannabis. And that'll be our last study that we're going to look at today of my own research that is published in Sexual Medicine, a peer-reviewed journal, and the percentage of women who were able to orgasm during partnered sex learning how to use cannabis. That'll be the last study. So where? Choose a place of safety, not just in your body, but in a physical location. Wherever you are, that there isn't going to be a child coming in, or you're worried about somebody knocking, or someone's going to be, you have an appointment in 20 minutes that you're thinking about. So the where, it's safety in your body. And I want to say welcome to those of you that are here. It's the where is not just physical. Am I feeling safe in my body? Where is safety? Where is tension? Where is pleasure? All of those things matter. And then the why. So who, what, when, where, and why? Why? Because your orgasm map is individual. We just saw in this study that a number of women liked consistent stroking of their clitoris, the same pattern, and a number of women liked it to be changed. So what does this mean is that you've got to know what you like, and you've got to learn what you like, and you may like both. Some women may like stimulation that changes. Some women may like the same stimulation. And for some, it doesn't even matter, meaning as long as you're in flow, that you're in a flow state, you're able to just be fully present with the experience. Your orgasm, you're creating an orgasmic supportive state of being where orgasm will flow through you. So in those situations, it's not like, oh, because anytime you're in your thinking brain, we're in what's called the prefrontal cortex, right? If we're in our thinking brain, oh, is this feeling good? We're not in an orgasmic supportive state. An orgasmic supportive state has no thinking. It's not, oh, am I taking too long? That is not going to help access orgasm. What's going to help is getting into flow, connecting to what you're feeling inside your body, using breath, learning how to go into and out of an orgasmic supportive state and staying in it, learning how to enter an orgasmic supportive state, learning how to stay in an orgasmic state, and learning how to let your orgasm happen in an orgasmic supportive state. That's what my course is coming up. Starting September 15th, we're going to be launching Becoming Orgasmic with Medical Cannabis, as cannabis being an orgasmic learning pathway. And you can find that on my website at femaleorgasmtraining.com beginning September 15th. I'll be launching that 12-week program with Dr. Janester Wilson-King, an OBGYN medical cannabis doctor. She'll be guiding the medical cannabis side, and I will be guiding the exercises and the training to facilitate your clearing in your orgasmic supportive state, accessing orgasm in an orgasmic supportive state. So let's finish these 5 W's. The 5 W's of partnered orgasm. Who, choosing a partner you feel safe with, and communicating what you like. What, build arousal. Know what touch, pleasure, rhythm, and stimulation work for you. When, give yourself unrushed time and take the clock off your orgasm. Take it off orgasm. Where, be in a place of safety in your body. And why? Because your orgasm map is individual and your partner can't guess it. Okay, so let's get to the next study. Um, this next study is called Women's. Let's get it up on the screen first. Here we go. Share. Okay, so this next study is called. I'm going to make it a little bigger for you here. Okay, women's techniques for making vaginal penetration more pleasurable, results from a national representative study of adult women in the United States. And this study was published in 2021. And it was actually, Oh My God, Yes research group. For those of you that know Oh My God, Yes, it's a website with a lot of resources for helping women with videos, I think, become orgasmic. And in this study, what we're going to look at is 4 ways women make penetration more pleasurable. And it's highlighted in our paper here. I'm going to, for those of you that are listening, we're going to make it a little bigger. Here we go. Okay. So this was a study to assess a sample of women, 3,017 American women aged 18 to 93. Don't you just love it that they run all the way? I mean, up to 93. That means you could complete the survey as old as you were. And in this study, it was women up to age 93. And the data suggested, okay, that 87.5% of women make vaginal penetration more pleasurable using angling, rotating, raising, or lowering the pelvic hips during penetration to adjust where inside the vagina the toy or penis rubs and what it feels like. So, using your hips to angle yourself in a way that you actually feel more pleasure. The second way is called rocking. And 76% of women make vaginal penetration more pleasurable using rocking. The base of the penis or sex toy rubbing against the clitoris constantly during penetration by staying all the way inside the vagina rather than thrusting in and out. So we have so far angling, where we move the hips in a certain position to have more pleasure, whether it's to your cervix. Some women orgasm cervically. Some women orgasm vaginally. Some women orgasm by touching their clitoris, which is we're going to get to that one. Okay, the next one is called shallowing. And in shallowing is 84% of women made vaginal penetration more pleasurable using shallowing. Penetrative touch just inside the entrance of the vagina, and not on the outside, but also not deep inside, with a fingertip, sex toy, penis tip, tongue, or lips. So when we talk about vaginal penetration, we might always think of the penis, but that's not what it always is. We just heard that it can be done with the tongue, it can be done with a finger, it can be done with the penis tip, it can be done with lips, it can be done with a fingertip, as I mentioned, and or a sex toy. So, and in trying all these different techniques, and for women again to say, hey, I want to try this. And it's always good. One of the things I'd like to suggest is having a container. And what that means is a container before you have sex. And it might not be right before, because right before maybe kissing is already beginning and you're already getting in the mindset. But maybe, when you're having dinner, or sometime when you have laying in bed together, and say, hey, next time we have sex, I would like to set this container where we try this new technique. I learned about this technique called shallowing that a lot of women use, and having the penis just inside the vagina, or the sex toy just inside the vagina, or the finger or the lip, whatever you decide, but trying it just inside the vagina and see how you like it. And then the fourth technique is called pairing. So 69.7% of women orgasm more often or make vaginal penetration more pleasurable using pairing. When a woman herself, solo pairing, or with her partner, partner pairing, reaches down to stimulate her clitoris with a finger or sex toy at the same time that her vagina is being penetrated. Now, we learned last week, interestingly, that women who are in longer term, actually, it was 2 weeks ago, women who are in longer term relationships, like with a regular partner, they're more likely to use a sex toy, and that in relationships that are longer term, sex toys actually enhance satisfaction of the relationship, and that women that were in shorter term relationships were less likely to bring in a sex toy. And we often hear about that. I talked about that a few weeks ago, how a woman had her boyfriend was complaining about he thought he should be able to bring her to orgasm, and he didn't want her using a sex toy. But we learned that sex toys actually enhance her pleasure. So why not? And the other thing is, for those of you that are familiar with using tools or hammers, like hammers and nails, like why would we try to hammer in a nail without a hammer when we know a hammer works? Why would we not wear glasses if we know that glasses are going to help us see better? It's the same with orgasm. If we know that a woman can have a better orgasm, and this is for the women herself, if you know you can have a better orgasm with your clitoris being stimulated with a vibrator, then bring in your vibrator. Say, hey, I can actually attest to that with someone who I had helped was unable to access orgasm and was very frustrated in her marriage. And the way she finally accessed orgasm was being on top and using her vibrator to stimulate her clitoris while he was inside of her. And you know, she learned a new pathway that was working for her, and I haven't heard from her since. So I know that she was like, "Yep, it worked," and great. Okay, so the 4 ways women make penetration more pleasurable. Let's just kind of summarize this. Angling, changing the angle of the hips, pelvis, so penetration rubs a more pleasurable area. Think, adjust your body. And maybe it's not think, I don't really like the word think, but just move into adjusting your body. Don't just accept the angle that you're given. You have the right to move your body so that it's more pleasurable for you. Shallowing, stimulating just inside the vaginal entrance, rather than deep penetration. And 25% reported stronger orgasms after shallow stimulation, and 40% reported more pleasure. So shallowing, and 83% of women are using this technique. Rocking, instead of repeated in and out thrusting, stay more fully inside so the base of the penis or toy maintains contact with the clitoral area. 70% had used rocking with the penis to make penetration more pleasurable. And the last one was pairing, combining penetration with clitoral stimulation. And the study specifically asked about pairing to orgasm more often or have more pleasurable sex, that was the reason. So pairing is another really good, reach down there, ladies, and touch your clitoris while you're having penetration, or bring in a toy and enhance your pleasure and let your partner know, hey, this is what I want and this is what I'd like. And I mean, I remember interviewing a woman for my research that stopped seeing a guy because she wasn't satisfied with her sex, with the sex with him. She just said he just was focused on himself and she wasn't interested. And I heard a guy one time actually tell me how he didn't really wasn't concerned at all about his partner's orgasm. And it kind of surprised me. So, there can be over focus, there can be under focus. The over focus can actually create pressure when a partner is pressuring their partner to orgasm because they need it for their own ego. And so next week, we'll talk about the partner side. This week, we're talking about what the woman can do to enhance her orgasm while she's having partnered sex. All right, let's move to the next study. This is a study. Let's take a look here. I'm going to just clean it up so you can see it as big as possible. Rowland, who conducted this research in the Journal of Sexual Medicine, the relationship between masturbation and sex in women. Does the former facilitate, inhibit, or not affect the latter? Meaning, does masturbation have any effect on partnered sex in women? That's what this study is about. And there's a real theme in this that's 6 words that I'm going to mention to you right after we read this abstract. Okay, so this introduction is the relationship between masturbation activities and their effect on partnered sex. He's saying that's understudied. The aim of this is to assess the alignment of activities between masturbation and partnered sex and determine whether different levels of alignment affect parameters during partnered sex. So there were 2,215 women, and they completed an online survey about masturbation and the reasons for orgasm difficulty during masturbation. And those were compared with activities and reasons for orgasmic difficulty during partnered sex. And the main outcome of the measures was used to predict sexual arousal, difficulty, orgasmic probability, orgasm pleasure, orgasm latency, and orgasmic difficulty during partnered sex. The results showed that women showed only moderate alignment regarding masturbation and partnered sexual activities, as well as reasons for masturbation orgasmic difficulty and reasons for partnered sex orgasm difficulty. However, those that showed greater alignment of activities, meaning what that means is if you're stroking your clitoris one way during masturbation and you stroke your clitoris the same way during partnered sex, you're more likely to have success in experiencing orgasm. If you do something similar during partnered sex that you do during masturbation, you're more likely to have success. So it says here, those that showed greater alignment of activities, that's what that means, showed better orgasmic response during partnered sex and were more likely to prefer partnered sex over masturbation. So it says here, the clinical implications: women tend to use less conventional techniques for arousal during masturbation. So a conventional technique would be like stroking the clitoris, right? A non-conventional technique might be humping a pillow. Like we know a lot of women can orgasm through humping a pillow. And there's even pillows you can buy online through a woman in Germany who sells these humping pillows because women like to orgasm like that. But that's not typically going to be, sometimes a woman's going to feel shame. This is how I orgasm and I feel shame. You don't have to feel shame. Never have to feel shame. Please, please, you can leave shame out the window, out the door. And I know shame is a very difficult thing to remove from oneself because I suffered from shame myself for a very long time. So shame is kind of can be imprinted. And the way sometimes we're going to move through shame is through discomfort, meaning it's going to be uncomfortable. At least that's my experience. It was uncomfortable to like, okay, me and my shame and are going to go to this program in London. And it was difficult, let me tell you. But when I got to this program in London and like, here I am, me and my shame, and there was a party going on, I swear to God, my suitcase of shame opened up and went out the window. And I never had to deal with it with that level of how it affected me again. So confronting shame, very, very important, even though it's not in the direct topic of what we're talking about. This topic is about orgasming during partnered sex. Shame about how you might masturbate could be part of why you're having difficulty orgasming with a partner. Okay, so it said, let me read this again. The clinical implications: women tend to use less conventional techniques for arousal during masturbation compared with partnered sex. And it's unfortunate they say less conventional. Like, who's to judge that this way of orgasming is less conventional than that way of orgasming? We put that on ourselves. So you can take all that off and you can orgasm any way you want. You have permission. Orgasm the way you want and the way that works, and own it. This is how I orgasm. And maybe you can discover new ways. At least that's what happened for me, was I discovered new ways of orgasming by removing all the shame and allowing myself to flow. And for me, it was using cannabis too, but we'll get to my research. That my research paper and the results are last during partnered sex. So I'll show you that after. So let's get into now what this study actually is teaching us. Okay. Um, so there are actually the theme of this study, as I said in the beginning, was 6 words: discover it solo and transfer it partnered. Discover it solo, transfer it. So the more you can discover it solo, the more you can transfer it to your partner. Discover what works when you're alone. What kind of clitoral stimulation works for you? What body position? Do you use fantasy? Fantasy is great, actually. For me, fantasy is one of the ways that I actually learned how to orgasm, because I was always worried about, like, am I going to orgasm? Am I feeling anything? If you can get into fantasy, you can learn how to orgasm. And fantasy is an orgasmic learning pathway. That's another topic, but when we're going to go over orgasmic learning pathways in September, on my next series in September, I'm going to be gone for 2 weeks. I'm going to Greece. We have a show on the 25th of August, and then we will be off until I come back the 9th of September. So I don't know. We'll see about having one the day after. Okay. So discover what works when you're alone. And that includes, do you use a vibrator or other aid? Vibrators don't really work for me. I don't know. They just don't. I'm a fingers kind of girl, right? Vibrators don't really work for me. Then bring these same ingredients into partnered sex. So think about a recipe, right? Think about sex like a recipe. So if you know that you can make scrambled eggs with butter, and that's how you like your scrambled eggs, then when you're cooking scrambled eggs with a partner, make them with the butter, because you know that works. Same with your orgasm. If you know you can orgasm by stimulating your clitoris while you have say you have a dildo inside, the more you can align your technique with masturbation to partnered sex, the better chances you're going to have of having an orgasm. And that is, like I shared, is going to mean overcoming, using your voice, bringing in that vibrator, bringing in that pillow, bringing in whatever you use to orgasm with your partner. Let your partner see you orgasm. These are all capacities and skills that you can develop over time. Okay, orgasm likelihood increased. We know that. The high alignment, 69%. If they aligned well, 69% of women were going to orgasm during partnered sex. Low alignment, let's say 52%, but still. Orgasm pleasure increases too if you have higher alignment between masturbation and partnered sex. What women were most likely to transfer. Okay, so what skill most likely transferred from masturbation to partnered sex? Guess what it was? Clitoral stimulation. What most likely transferred is how the clitoris is stimulated. And one important thing to learn is that orgasmic women don't necessarily orgasm in every position, in every way, no, it doesn't work like that. It seems that I used to think that too, until I interviewed women who were, or who never had a problem with orgasm. And they have their ways. One woman would orgasm through, her way was through her cervix. She would have cervical orgasms. And then she had her cervix removed during a radical hysterectomy, and she lost her ability to orgasm, and she learned new ways to orgasm with cannabis medicine. Different show, but the point is that women who have the ability to orgasm typically have their favorite ways to do it. And I'm welcome to your comments. So if you have any comments or questions, for those of you that are here, I welcome your comments and questions. So let's see, orgasm pleasure increased. We know that clitoral stimulation, 94% of women who used clitoral stimulation during masturbation also used it during partnered sex. So you can join the majority of women and stimulate your clitoris during partnered sex. And then let us know, like, hey, yes, I'm starting to orgasm. I started bringing in my fingers, during partnered sex. And what they were less likely to transfer was fantasy, body position, anal stimulation and vibrator aids. So they were less likely to transfer these in, which, if those are the things that work, then you can bring them in. So the key message from this study we just looked at is masturbation by itself was not the magic ingredient. The transfer of the skills was the magic ingredient. It's not masturbation. If you could masturbate by yourself, great. But learning how to transfer the skills of how you masturbate into partnered sex is how you're going to become successful orgasming during partnered sex. One of the ways. Okay, let's get to the next study. This next study is also from the Journal of Sexual Medicine, and again by the same researcher. You'll notice David Rowland again listed here. It's called Orgasm Latency and Related Parameters in Women During Partnered and Masturbatory Sex. So let's see what this study, let me just see here. This one has a theme, and I'm going to tell you the theme right now. It's take the clock off your orgasm. Take your clock off your orgasm. Remove it. No clock. No evaluating time. So let's see what he studied. Okay, so orgasm latency during partnered sex and orgasm latency during masturbatory sex in women with and without orgasm difficulty has received minimal attention. The aim of this study was to assert whether partnered orgasm latency and masturbation orgasm latency, both overall and both more specifically in women with and without orgasm difficulty. It's like a mouthful, right? Basically, they want to see, is there a difference between the amount of time it takes to orgasm for a woman during partnered sex and the amount of time it takes for a woman to orgasm during masturbation? So let's see what he did. There was a study of 2,304 women from a community-based sample from the United States and Hungary, interestingly enough, who completed a survey. And the main measures were self-reported orgasm latency, meaning how long it took to orgasm, and related orgasmic parameters during masturbation and partnered sex in women with and without orgasm difficulty. The results, this is always the best part, right? Partnered orgasm latency, meaning the amount of time that it took for a woman to orgasm during partnered sex, was longer than those during masturbation. Meaning it took longer for women to orgasm during partnered sex than it did during masturbation. Women experiencing difficulty reaching orgasm showed even longer latencies. So if a woman has orgasm difficulty, the amount of time it's going to take to orgasm is even going to be longer during partnered sex. But the comparable latencies during masturbation, meaning say it takes 10 minutes for a woman to orgasm who has orgasm difficulty, takes her 10 minutes to orgasm during masturbation. But for the women who have this orgasm difficulty, it might take 30 minutes for her to orgasm during partnered sex. So the covariates that related to this, meaning things that related to this gap of time, like how long it took to orgasm during partnered sex, included age, the relationship quality, the frequency of masturbation, the masturbation orgasm latency, meaning how long it took for her to orgasm during masturbation, and the level of distress about not reaching orgasm. That's a big one. The level of distress. So many women feel, what's wrong with me? Is something wrong with me? I can tell you that I used to feel a feeling of inadequacy, sexual inadequacy, because I would go into start dating a guy and thinking, oh, I got to bring this package with me. Like my orgasm problem is going to come with my relationship, right? Me and my orgasm problem are going to go meet this guy. I hated that. So the level of distress and learning how to okay, I'm in an orgasm learning pathway. Another topic, but becoming orgasmic with medical cannabis is one way to do it. And my training program, as I mentioned, we're going to launch that September 15th. Okay. What are the conclusion? It says here, masturbation orgasm latency for women and partnered sex orgasm latency for women differ significantly, with the latencies during partnered sex being substantially longer than masturbation, meaning it just takes longer for women to orgasm during partner sex than it does during masturbation. Although women reporting the greatest difficulty reaching orgasm have the longest latencies and are likely to find masturbation more satisfying than women who are not. So, women, if they have a long latency to have orgasm during partnered sex, they are likely to find masturbation more satisfying than women who do not have these latencies. So let's look at what this actually means. It basically means, as I mentioned, take the clock off orgasm. The partnered orgasm, and this is kind of a summary of what this study says, partnered orgasm usually takes longer than solo orgasm. Okay, we can accept that. Can we accept that? It's gonna take us a little longer? I mean, when my husband asked me when I was married, he was like, "Did you come yet?" And I was like, What?" Like, does that help orgasm? No, it doesn't help orgasm. I don't remember what happened, whether I orgasmed or I didn't orgasm at that time, but I remember the question, did you orgasm yet?" Like, he was impatient and ugh. Okay, partnered sex, it takes on average about 14 minutes for a woman to orgasm, and masturbation about 8 minutes. So just know that, like, you can take your clock off your orgasm. If you have difficulty orgasming with a partner, you may simply need more time. Can you give yourself more time? Can you? That's a key. Give yourself more time. Women without partnered orgasm difficulty, it takes them about 12.2 minutes to orgasm. Women with orgasm difficulty takes about 17 minutes. So give yourself the time that you need. Difficulty with a partner does not mean you cannot orgasm. Again, these are coming out of this particular study. Women who struggled with partnered orgasm had almost the same masturbation latency as women who did not struggle. So let's see what this means. Women who struggled with partnered orgasm, if they struggled to orgasm during partnered sex, they had about the same amount of time it took to orgasm during masturbation. So women who did, sometimes it's like even difficult for me to like what? So you have two groups of women who have difficulty orgasming during partnered sex and women who don't. And these women masturbate, right? Okay. So these women masturbate, let's say on an average of 8 minutes between the two groups. But the women who had difficulty orgasming during partnered sex, those women struggled with partnered orgasm, had the same, whether they struggled or not, they struggled and they had the same amount of time orgasming during masturbation, meaning in some ways it could have been in her head. Like, I have trouble doing partnered sex, but she can orgasm in the same amount of time as a woman who doesn't have difficulty orgasming during masturbation. And what that suggests is that the difficulty, this is exactly where I was headed, is specific to the partnered situation, not the woman's orgasm difficulty. So the guy who puts the lube on and starts jackhammering away, she may not be able to orgasm because he's going to be done in what? I don't know, maybe 2 minutes, maybe 5 minutes, maybe 10 minutes, but it doesn't sound like she's really participating. So, for her to be able to give herself permission to say, "Don't put the lube on yet. I'm not ready." Because maybe she knows when sex starts, it's over in 2 minutes, or when sex starts, he's just going to be penetrating her and there's no more clitoral stimulation. So what it says is that the difficulty relates to the partnered situation. And here's another key. I have a key for you. Don't stop when your partner orgasms. Many women orgasm after the partner orgasms, even with a less erect penis. He orgasms, he stays inside. I know a woman who had multiple orgasms, in fact, after her partner orgasmed, and he stayed inside of her, and she was able to stimulate herself. She was on top, and she found herself having multiple orgasms. So it's not about the penis being erect. It maybe the pressure is off, that okay, I can just orgasm now when I want. But don't stop when your partner orgasms. The author specifically noted that women's longer orgasmic latency can become a problem if stimulation ends when the male partner ejaculates. So just because he ejaculates and he's done doesn't mean that you have to be done. You can stimulate your clitoris. I know many times men are tired after they ejaculate, but then there are men who are not. They can go around another round again. And you don't have to stop because your partner stopped, because your partner's done. Big key. Pressure can make it harder. Okay, yeah, I did a whole show a few weeks ago about the pressure, orgasm pressure. Greater distress about not orgasming was associated with it taking longer to orgasm. So the more distress the woman had about wondering or worrying, am I going to orgasm? Am I not going to orgasm? Number one, the more chances she would have of not orgasming. And number two, the longer it would take for her to orgasm. And the last one is that arousal matters. Different difficulty becoming aroused during partnered sex was also associated with taking longer to orgasm, and the authors raise inadequate clitoral stimulation as one possible contributor. So one of the key things is to be able to ask for what you want. And even if you don't know what you want, you can say, you know what? I want to feel, let's just try a couple different strokes on my clitoris. I want to feel like, have your partner. And that's what orgasmic meditation is good for those of you that know of or have practiced orgasmic meditation. It's a 15-minute practice where typically a male strokes the woman's clitoris for 15 minutes and it's done in a container. You can Google it, it's online. I have done orgasmic meditation and it was very helpful for me to learn how to access orgasm, ask for what I want, know what I want, and not have any shame about speaking up. So, highly recommend it. Okay, we have two more studies here and we have a little bit more time. This is an interesting one. This is differences in orgasm frequency between gay, lesbian, bisexual, and heterosexual men and women in the US. Now, this particular study, when we hear about this already, differences in orgasm frequency, we know that's going to mean the orgasm gap, right? But that's typically what this is going to. That's what it's good. That's what it relates to. And this is actually a. It doesn't look like it's a peer-reviewed journal article, and if it was, then this you can see the format is even different, right? It came out of this particular university. So what I'm going to do is just give you the study 5. I'm going to give you what came out of this particular study, and let me go to the title so you can see it, because we're recorded also on 10 podcasts. So it's not always just people watching on YouTube. Some people listen through podcasts. So I like to repeat the title. It was done in 2017 for those who might want to look it up at another time. Differences in orgasm frequency between gay, lesbian, bisexual, and heterosexual men and women in the US. So the takeaways from this study is basically expand your sexual script. That's what they learned from this study. Don't make intercourse the whole event. That's what they said. This study said, don't make intercourse the whole event. Women who combine multiple sexual activities reported more frequent orgasm. So that would include enjoying oral sex, making sex a practice versus going into the Olympics of sex, and, that it's penetration and then, the man ejaculates and, it's over. No, you can look at Tantra, Margot Anand wrote a book, The Art of Sexual Ecstasy. It's a whole year program of practices of eye gazing. The first one's like eye gazing, like learning how to look into your partner's eyes and connect there, learning how to access flow. We've talked about flow states in previous episodes, and it's actually one of the ways that I orgasmed, with a partner was through just being in a flow state after my partner had orgasmed, not even with no clitoral stimulation. Actually, it was while he orgasmed. His orgasm went into my body, in fact, because I could feel this heat and there was no clitoral stimulation. There was no penetration. I just was on top in a flow state while I was stroking him. And I felt this heat enter my body. And I said to myself, oh my God, I'm going to orgasm. And I orgasmed. And when I opened my eyes, he orgasmed. Then we both burst out laughing. Like, oh my God, we can't believe this happened. So flow state. None of these talked about flow states, the research that we looked at here, but accessing a flow state. And a flow state is an orgasmic supportive state. This is the language that you'll hear me start talking about: orgasmic learning pathways, flow states, orgasmic supportive states. Those are the things we're going to talk about. Okay, so don't make intercourse the whole event. Women who combined multiple sexual activities reported more frequent orgasms. And the strongest combination. What's the strongest combination? This study looked at the strongest combination: oral sex and manual genital stimulation and deep kissing. 80% of heterosexual women reported usually or almost always orgasming. That's pretty cool, right? So I'm going to repeat that. The strongest combination: oral sex, manual genital stimulation, deep kissing. 80% of heterosexual women reported usually or almost always orgasming. Did you notice penetration was not in that list? Oral sex, manual genital stimulation, deep kissing. That's for partners too. Maybe we'll talk about that next week. And adding vaginal intercourse, okay, 77% was, if you add that also, 77% said yes. Oral sex, manual genital stimulation, deep kissing, and you can add the vaginal intercourse, 77%. So give yourself the time, keep the stimulation going, take the pressure off. And the last study I want to look at here is actually one of the orgasmic learning pathways that we're going to talk about in September. And what is an orgasmic learning pathway? All right, let me take you off. I'm going to take this off of, well, I'm just going to go right to the study and continue talking. So, orgasmic learning pathway is a pathway that is facilitated through accessing an altered state of consciousness, an altered or an absorbed state of consciousness. And we know through research that women need to be in an absorbed state of consciousness more than men, interestingly, right? And that is shown through research by Costa. This woman had done research showing that women who access altered states of consciousness are more sexually responsive. We know through the definition of female orgasm that it includes an altered state of consciousness, and cannabis is one of the orgasm pathways, orgasm facilitating pathways, an orgasm learning pathway, because it alters the state of consciousness. So this was my study. This was my dissertation research with Dr. Jordan Tischler back from 2024. Actually, we did the study in 2022, but I had to do all the statistics and everything. And what I want to show you here, well, I'm going to read you the results, okay? It was of 1,037 survey respondents, 410 were validated and completed. 23 surveys were returned. Okay, we know about that. But the bottom line was, of the valid surveys, most women, 52%, or 202, reported difficulty achieving orgasm during sexual activity with a partner. These women were primarily between 25 and 34 years old. 75% were white, 52% identified as LGBTQI, and 82% were married or in a relationship. Among participants who experienced challenges in experiencing orgasm, 72.8% reported that cannabis use before partnered sex increased orgasm frequency, 67% that it improved orgasm satisfaction, and 71% indicated that cannabis made orgasm easier. The frequency of cannabis use before partnered sex correlated with increased orgasm frequency for women who experience difficulties experiencing orgasm. The reasons for cannabis use before partnered sex resulted in a more positive orgasm response. And what that meant was women who used it before sex, for example, if they used it before sleep, they weren't like as likely to have an orgasm, obviously, because they used it to go to sleep. But the reasons for partnered sex mattered. And I want to show you a, a bar chart in here that really depicts the impact, from having conducted this research, having myself been one. Here we are. Some frequency. So if you take a look at this top chart, I'm going to make it bigger here so you can see it. Okay, so I want you to look at the dark gray is the with cannabis and the light gray is without cannabis. And if we're going to look first to the right-hand side, 74, the largest group of women who reported having orgasm difficulty and did not use cannabis before sex almost never or never experience orgasm. The largest group of women with cannabis who used cannabis before partnered sex and had orgasm difficulty during partnered sex, the largest group of women almost always orgasmed during partnered sex. And this result, along with ease, orgasm frequency, orgasm ease, and orgasm satisfaction, were all statistically significant. And what does that mean? Statistically significant means that it wasn't by chance, that it wasn't just luck, that these women, that it was the cannabis that actually was facilitating and I'm not going to say causing, because it's not about the causing orgasm. It facilitates an orgasmic supportive state when we talk about being able to be in an absorbed state. And cannabis is a multimodal treatment, meaning that it can facilitate enhancing sensation, slowing down time. Remember, we talked about taking the clock off of our orgasm? Cannabis can help you do that. Quieting your thoughts, cannabis can do that. Cannabis can actually dishabituate your thinking. So if the thinking is always, oh, I don't know if I'm going to orgasm this time, cannabis will quiet that thought. Cannabis also, THC, the THC in cannabis has been found to reduce amygdala activity. Okay, so you might say, what's amygdala activity? Amygdala is the part of the brain that stores trauma. So for women who might have had childhood sexual abuse, rape, any kind of sexual trauma, sometimes